Hello and welcome to NHIS in a Week, where we give you the happenings in the authority and the scheme. My name is Shanice Palm. To our headline, NHIS CEO tours Ashanti region. NHI in final stages of confirming mental health tariffs. And NHIS sets the stage for staff credit union. To our first story. The Chief Executive of the National Health Insurance Authority, Dr. Victor Bampo, embarked on a tour in the Ashanti region. The tour marks a major step in his commitment to understanding frontline challenges, engaging with NHI staff, and deepening partnerships to strengthen Ghana's health insurance delivery.
Dr. Bampo kicked off his regional tour in Kumasi with a media engagement and interaction with NHI personnel. He visited the Ashanti Regional Office, toured the Kumasi Claims Processing Center, and addressed a number of staff from across the region. The visit, part of a broader national tour, aims to strengthen NHI's operations at the grassroots level. Dr. Bampo encouraged staff to share their grievances and ideas, reinforcing his commitment to active, collaborative leadership.
As Regional Director said, you are the people who actually do the work. So we are actually here to hear from you. I'll speak just a little bit and then I'll ask my directors to also contribute to the conversation. But this is a short meeting and we want to hear from you mainly.
He also outlined NHI's new vision, rooted in 3 pillars: enhancing operational efficiency, improving staff welfare, and supporting government's universal health coverage agenda through Mahama Cares and free primary healthcare initiatives.
Just want to give you a little view or a little insight into the vision that we have as executive management. 3 things. Number 1, it's about you. It's about how we make sure that your welfare is what is on our hearts. The second is the customer experience, and that is where you also come in. Where I've gone to, a lot of people talk about out-of-pocket expenditure. This does not give the scheme a good name. So one of the things I really want to focus on is how we make sure we eliminate that. I'm sure you've heard about the co-payments and claims committee that we've set up. We'll be coming to some of you so that you give us the benefit of your experience on how we can minimize that. And then the final thing is actually what I think Dr. Jokoto mentioned. Mahama Cares, free primary healthcare. It's very important to the president because we want to achieve universal health coverage.
Dr. Bampo assured staff of better tools, training, and welfare systems and stressed the importance of eliminating illegal charges, also known as co-payments.
I'm blessed with a very good executive management team. Anatu, Raphael, who you all know, Senan, who is in Kumasi, now also doing something else. They're bringing up a lot of ideas. We're setting up this credit union, which means that after you've contributed for 6 months, you can go borrow money to buy a plot of land, to buy a car.
Staff in the region who have exceeded their performance targets pledge renewed commitment to the authority's mission. Addressing the media, Dr. Bampo noted the strategic importance of the Ashanti region, home to 17% of NHI's membership and over 600 credentialed facilities.
Ashanti is a very important region. It's the second most populous region in Ghana and actually has 17% of people who are on the scheme. So it's an important region for us. It has the most number of districts where we have offices. It also has the most, the greatest number of credentialed health facilities, which is 631. So anything that we want to do with the scheme, it is important for us to come to Ashanti.
He thanked President Mahama for his appointment, calling it a huge responsibility in achieving universal health coverage.
I want to take the opportunity to say a big thank you to His Excellency President John Dramani Mahama for giving me this opportunity to serve. It's a huge role that plays a very important part in attaining universal health coverage.
On claims payment, he confirmed the release of over 965 million Ghana cedis to providers in 2025 alone following the uncapping of NHIL.
Just last week, I signed off 129 million cedis to providers. 2 weeks ago, I signed off 555 million to providers. This year alone, the National Health Insurance Authority has released 965 million cedis to providers. I don't think there's anything else that we can demonstrate to show that President Mahama and his NDC government are fully going according to the promises they made to make sure that providers are paid the funding that is due them.
He credited this financial breakthrough to the repeal of Act 947, assuring that funds will now be disbursed within 30 days as mandated by law.
You remember that when President Mahama was campaigning to be president, he talked about uncapping Act 947, which was the capping and earmarked act that had been put in place, which meant that the full complement of the National Health Insurance levy was not accruing to the National Health Insurance Fund. As you are aware, one of the first things he did was to repeal that. Parliament has repealed it and the President has signed that, which means that the full complement of funding is coming to the NHIA. We have the full assurance, and it's been demonstrated from the Minister of Finance that he's actually going to go according to the dictates of the law. So now all the funding within 30 days is coming to us. This gives us the full complement of funds to make sure that we are able to pay to providers.
Clarifying the relationship between Mahama Cares and NHIS, Dr. Bampo explained that the two policies complement each other by closing gaps in coverage, especially for non-communicable diseases, and ensuring access to dialysis and basic care for all Ghanaians, NHIS member or not.
If you look at the NHIA, even though we cover 95% of all disease conditions, sometimes there are gaps when it comes to some of them. We cover 4 childhood cancers and a few of the cancers, but not everything. So what Mahama Cares is supposed to do is to bridge that gap so that those diseases that are not already covered will be covered. Now, you talked about end-stage renal failure. Yes, previously there were 20 facilities that were looking at renal failure, which is becoming a bigger and bigger challenge in Ghana. What Mahama Care seeks to do and will do is to systematize these dialysis centers, make sure that all over Ghana we have these dialysis centers that Ghanaians can utilize. And so with the other diseases. So we're actually broadening the system and making sure that we're able to take care of the diseases that are now prevalent in our society. So that's where Mahama Care comes inside.
Dr. Bampo's team continue to tour in Bono East and Bono regions. He was joined by NHI leadership, including Dr. Abigail Kujode Chikwateng from the Claims Directorate, Mr. Oswald Esua Mensah and Ms. Faustina Derry, both from the Corporate Affairs Directorate.
Our next story, the NHI is finalizing tariffs to include mental health services under the National Health Insurance Scheme. This move is part of a broader effort to ensure no Ghanaian is left behind in accessing mental wellness care.
At the launch of this year's Mental Health Awareness Month, Health Minister Honorable Kwabena Mintah Akando announced plans for a national mental health hotline to provide e-counseling services.
Mental health is a priority, and not just in word, but in action. Ladies and gentlemen, I am pleased to reaffirm today some of the core mental health commitments we made in the 2024 manifesto. We will establish mental health hotlines, as has already been mentioned by the Chief Executive, under the National Health Insurance Framework, allowing Ghanaians to access professional support and e-counseling services at the district level when they need it most.
NHI Acting Director of Corporate Affairs, Mr. Oswald Isuamensa, reaffirmed the authority's commitment to covering mental health conditions such as depression, anxiety, and schizophrenia under the scheme.
At the NHIA, we recognize that ensuring access to mental health care is critical to building a healthier and stronger community. And that is why the National Health Insurance Scheme has considered coverage of some mental health conditions, namely depression, bipolar disorder, anxiety, and schizophrenia. Our aim is simple, that no one should be denied care they need because of financial barriers.
The events themed Mental Well-Being, My Voice Matters also featured remarks from Mental Health Authority CEO Professor Pinaman Apau and Vice President Representative Honorable Dr. Samuel Ofosu Ampofu, emphasizing inclusion, advocacy, and access. NHIA also set up an on-site registration and renewal desk, underscoring its goal to eliminate financial barriers to care.
Moving on, the NHI is set to launch a staff credit union to support employee welfare and financial stability. The initiative will provide access to savings and affordable loans across the authority.
The new credit union aims to offer NHI staff a safe and supportive financial system where savings and accessible loans can help reduce financial stress and foster solidarity. This internal welfare initiative is part of the new executive management's broader commitment to empower staff. Through the union, workers can expect improved access to credit, financial literacy initiatives, and long-term security, reinforcing NHI's people-centered approach, not just for members, but for its workforce too.
To our final story, the NHIA in the Upper West region joined an interdepartmental sports competition organized by the Ghana Health Service to promote unity and wellness among public sector workers. The event was held at the BK Adama Youth Resource Center in Wa.
The interdepartmental games featured spirited competition in football, volleyball, sprints, and novelty races, with NHI's teams securing multiple podium finishes. Institutions including Ghana Health Service, Ghana Education Service, the Fire and Prison Services, and Bahas Foundation participated. NHI's Regional Director, Mr. Rashid Mohammed Tindogo, encouraged staff to prioritize fitness and join the local KFIT club. The authority emphasized that staff wellness is vital to meeting its performance target and delivering quality healthcare services.
She's me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro board damn.
Hello, ma.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This is all we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.